Hello, I'm Dr. Gerard Silvestri. I'm a professor of medicine at the Medical University of South Carolina in Charleston. I've been there 20 years. I'm a lung cancer pulmonologist and also an interventional pulmonologist, and mostly do research in both of those areas. So this edition of Clinical Respiratory Medicine is the 4th edition. The book's fantastic. We put together an editorial team both from the United States and in Europe. Stephen Spiro led the effort, and I've known Stephen for 15 years, and he's been my mentor actually from outside the United States. He brought in Dr. Augusti from Barcelona, Spain, and the writers of the book are a combination of Europeans and Americans as well, and so we have that flavor of both sides of the pond working on the book together. Some of the really, I think, interesting features about the book are particularly some of the online content. So we have a lot of video clips, particularly around things like interventional pulmonary procedures and bronchoscopy, as well as echocardiography and the like. And so the online content is very good. We also have online testing that can be done. So questions were written for each chapter of the book, and people can take the test to assess their skills. And they're very practical questions. They're not going to be sort of your basic science questions, but more how to practice pulmonary medicine. The book has been updated dramatically since the 3rd edition. In the 3rd edition to the 4th edition, new issues like screening for lung cancer, new procedures have been added to the book, new medications and treatments for diseases like pulmonary hypertension and interstitial lung fibrosis have been all added to the book since the 3rd edition. So in a lot of ways, their chapters have been fundamentally updated between the 3rd edition and the 4th edition. The editorial team for this book came together through a really long-standing relationship with Stephen Spiro. I've known him for more than 15 years. And in 2004-05, I spent a year on sabbatical in London from my university in the United States. Did a lot of work with Stephen, a lot of research, and so he'd been talking about this book for a long time. He'd worked with one of my other mentors, Jim Jett, who was not on this version of the book, and I guess I was lucky enough to be the replacement editor for the legendary Jim Jett. And Dr. Augusti and Dr. Spiro both worked on several journals together on the editorial boards of journals, and so that's their relationship. And so Stephen asked me to help maybe represent more of the authors on the United States side of this book, and to garner new authors. I would think, I don't have the exact figure, but about a third of the chapters have been turned over to new authorship during the process of doing this iteration of the book. And so hopefully we continue to strengthen the authors for these books, give new people opportunities to write, people on the cutting edge in whatever field of pulmonary medicine they study. The book is used by different people at different levels of their career in a number of ways. I really think for the junior person, it's an incredibly readable book to get them basic knowledge in certain subject areas within pulmonary medicine, so they can pick up the chapter on COPD, and it's very much initially at their level. They can get a rudimentary overview for a junior learner, a pulmonary fellow, young faculty, and a complete overview of the disease. But what you kind of miss as you're reading through this is that then all of the technical aspects, the higher level reading for senior faculty, is also there. So it's got the nice start of easily readable, easily understandable for a learning pulmonologist, a respirologist, and then there's the technical aspects that should appeal to physicians who are out in practice, or even senior investigators, to look through those chapters and gain some knowledge from them. One of the exciting aspects of the book is the electronic components of the book. So the book will be available also online, all the chapters, but we asked each chapter to focus on something that they could put into the online repository that was related to their chapter. So we asked for video clips to observe, for example, endobronchial ultrasound procedures. We asked for echoes to be put in, both normal echocardiography and also disease state echocardiography. We asked for extra pictures for disease states to be put in, and pathology and skin manifestations of certain diseases. So what you'll find in the online repository is this complete library of extra bits, be they video clips or pictures that just couldn't be fit into the chapters, and obviously online that you couldn't have a video clip inside the hardcover of the book. In addition to that, the online version for every chapter has questions that are geared towards mastery in the content area of that chapter.